Would you like to save money on your monthly Medicare premium? Well, stay tuned because I'm going to explain how you may be able to get help paying for your Medicare. Hi, I'm Shawneen Sullivan, founder of USA Medicare Plan, where we help people on Medicare find low-cost options for Medicare supplement and prescription drug coverage. If you find our videos helpful, please give us a like, subscribe to our channel, and leave a comment or question you want answered below the video. Today I'm going to talk about Medicare savings programs. These are federally funded programs that help people on Medicare who have limited income and resources pay for their Medicare costs. The individual state Medicaid offices administer the Medicare savings programs. The programs can help pay for deductibles, coinsurance, and copayments associated with the out-of-pocket costs for Medicare services. When you're retired and on a low fixed income, every dollar counts. Even if you don't qualify for full Medicaid, you still may be eligible for a Medicare savings program. Most people don't pay anything for Medicare Part A, but for Part B there's a monthly premium. Many people get assistance paying for their Part B from a Medicare savings program. When you're approved for a Medicare savings program, you'll also automatically qualify for extra help with Medicare Part D. Extra Help, or Medicare Part D low-income subsidy, provides reduced costs for prescription medications to Medicare beneficiaries with income and resources below certain qualifying levels. And when you get Extra Help, there's no Part D late enrollment penalty to worry about if you didn't apply for a drug plan when you were first eligible. In order to be able to apply for the Medicare Savings Program, you must meet the following criteria. You must already have or be eligible for Medicare Part A. Also, your income must be at or below the federal or state limits for the specific program. And finally, your resources need to be below the federal or state limits where you reside. There are 4 types of Medicare savings programs, with each having a qualifying level of income and resource limits. The guidelines are state-specific, so the limits can vary from state to state. Some states don't have limits on the amount of your resources or assets you can have. It's important to mention that these limits can go up every year, so you're encouraged to apply even if your income and resources are slightly higher than the amounts listed. Reach out to us if you have any questions on your state-specific guidelines. The resources that are counted in the Medicare Savings Program resource limits are money in checking or savings accounts, stocks, and bonds. The resources that are not counted are your primary residence, 1 car, burial plots, money for your burial expenses up to $1,500, furniture, household and personal items. Let's talk briefly about each Medicare savings program and the qualifying limits for the current year. The limits mentioned are federal limits taken directly from the Medicaid government website. It's important to note that each state's income and asset limits can vary. Alaska and Hawaii have higher limits for all the programs we're going to talk about. The first category type of Medicare savings program is called Qualified Medicare Beneficiary, or QMB. The monthly income limits in 2020 for an individual is $1,084 and for a couple $1,457. The asset limits are $7,860 for an individual and $11,800 for couples. The benefits for QMB include coverage for the Part A deductible, Part A premium, and hospital copays, skilled nursing facility copays, the Part B monthly premium, Part B deductible, and Part B 20% coinsurance. You won't get a bill for any Medicare covered services except for Part D prescription drugs. You'll have reduced copays through the Extra Help with Part D program. The next category of Medicare savings programs is called Specified Low-Income Medicare Beneficiary, or SLMB. The monthly income limits in 2020 for an individual is $1,296 and for a couple $1,744. The asset limits are $7,860 for an individual and $11,800 for couples. The benefit for SLMB includes coverage for the Part B monthly premium. If you receive Social Security benefits, this amount would be deducted from your Social Security check every month. If you qualify for the SLMB program, then the Part B premium would be paid by the government. The third type of Medicare savings program is called Qualifying Individual, or QI. The monthly income limits in 2020 for an individual is $1,456 and for a couple $1,960. The asset limits are $7,860 for an individual and $11,800 for couples. The benefit for qualifying individuals includes coverage for the Part B monthly premium only. With this program, you have to reapply every year and it's available on a first-come, first-served basis. The fourth type of Medicare savings program is called Qualified Disabled Working Individual, or QDWI. The monthly income limits in 2020 for an individual is $4,339 and for a couple $5,833. The asset limits are $4,000 for an individual and $6,000 for couples. The benefits for QDWI help pay the Medicare Part A premium. You may be eligible if you're under age 65, disabled, and working with limited income and resources. I hope this video has helped you learn about the Medicare Savings Program. If you can't afford the Medicare Part B premium, then this can be a great way to put more money back in your pocket every month. We specialize in saving our clients money, and we can help you save too. If you have any questions, please call or email us. Our service is 100% free, and we're happy to help you. If you like this video, please give it a thumbs up and be sure to watch our other videos to help you better understand your Medicare.